Anybody have a thought?
4.
Okay, I have one vote for one, or a vote, or a conversation about that. Anybody else have another answer that you'd like to consider?
4.
2, I heard a 4. What does that site look like? Or what is it like? What complication could you have if you have a big blister? What if you rub the top of that blister off? What could be your complication that's listed here?
Infection.
There is no contrast. It's beaming from the outside. External radiation is beaming from the outside. There is no contrast. There's no IV necessarily, right? We're just beaming from the outside. So that's how one could have gotten rid of. Picture the site, the skin. It looks like a bad sunburn, like a bad blister, right? So we talked about no rubbing on that, nothing but prescribed lotions on that, no sun exposure on that. So if you picture that, or you picture the last time you had a really bad sunburn or a bad blister, if you would rub it off after you towel dry after a shower, what could be your issue? If we expose that to something, the top comes off your blister, you get at risk for infection and bleeding. Are we okay with that? We don't know if it swells or not. I don't remember anything about that. Probably doesn't, really. So 2 probably wouldn't have been something that would have occurred. And there's no reason it's an external beaming that the patient should be at risk for anaphylaxis. It's not like they're ingesting anything. So that's how you could have gotten there. Picture what that site looks like. Anybody have one that you want to pick? Anyone that you want to rule out?
2.
You want to pick 2? What's the age criteria for limiting visitors? Nobody under age 16? Just picture that because I don't know anybody that can't drive coming in here. How about that for a way to remember the age group? The first one, we're talking about precautions. So her getting around, walking around her room has nothing to do with precautions, right? Nothing to do with safety. If the applicator was placed in there correctly, there shouldn't be worry about her coughing. That doesn't really make much sense either. And the fact that says, well, one person needs to wear a dosimeter, but nobody else does, that doesn't make any sense either. So visiting precautions, no pregnant visitors, nobody under the age of 16, stay at least 6 feet away from your patient, stay, bunch your activities, you as the nurse. Don't take linens out until the patient's done being radioactive. Definitely go through that patient education list. Okay, so I had a vote for 4. Anybody else have a different thought? This is a priority question. So what is the priority questions always have to focus on? Airway, breathing, circulation, and safety. Which one of those is the here and now? You only get to worry about one thing right now because it's a priority question. What does 3 have to do with any of those?
Internal bleeding.
Circulation. Priority answers are not things that occur in your future. They're the here and now. You're the nurse, you only get to do one thing. Here and now. So scheduling somebody for therapy tomorrow or in 2 hours or vital signs in 8 hours, none of those count as priority answers. That's not the here and now. So if you stuck with those principles, for priority answers, 1 and 2 could have been rolled out in your brain. That's not now, it's later. And if I debated between 3 and 4, the here and now concern is gonna have to be addressing airway, breathing, circulation, and safety. And emesis, worrying about blood, is your circulation part of that. Teaching is very seldom a priority answer. Or a patient refusing to wear SCDs, which was an answer on the last test. That's not really your priority concern as her nurse right now. Everybody good with that? If it was a care plan question, it would have been a different story. But this was a vital question. Okay, here was what we were talking about staging earlier, kind of process through that a bit, and then we'll go over that. Actually, I think this one was one that was on your quiz assignment. Yeah, it was. Question number 1 on there. Or tell me one that you want to rule out, or how you're going to figure out what's the right answer here. 2. Okay, so there was a vote for 2. I think 2 as well. Anybody else have something you want to rule out? Okay, number 1 is not correct because that T2 does not mean 2 centimeters. It's a range of sizes. So the T numbering, a T1 tumor is a smaller size than a T2. There's a scale. A T2 is smaller than a T3, a T3 is smaller than a T4. A T2 does not mean 2 centimeters. It means a range of size. So 1 is not correct in that regard. A T2 does not mean 2 tumors. It's a range. If you look in your book, you can see the range. I will score a T1 if the size is this much to this much. So T1 is not correct. It does not mean 2 tumors. So I'm down to 3 and 4. And there's no IS in there to indicate the number 4, right? And N1 means that's not correct either. N1 means there is lymph node involvement. So I'm going to get rid of 4 also. Everybody good on that? The primary tumor I know is some kind of range, so that makes sense to me. If you didn't really know what that range is, you could have ruled the other ones out, what I just did. And there, N1 is there is metastasis to some lymph node involvement. I know that because that N1 is there, and the M0 is no mets. So even if you didn't know number 3 was correct, if you ruled out 1, 2, and 4 as being incorrect, you could have gotten to 3. Does that make sense or no? Yes. That was your answer on your quiz assignment as well. Okay. That's not a very good day. What do you do about that? What don't you want to do, I guess, should be the question. What did you say you don't want to do? 3. Not 3? That's a good decision. I'm just going to put this back in you and hope it works. So we're not going to do 3.
We want to do number 1.
You aren't doing 2. Why are you doing 2? Yeah, we're going to do that.
She said, what don't you want to do?
Well, what don't we want to do? We don't want to do 2 and 3, so now we're down to 1 and 4. I would say 4. 4. They will provide you with a container in the room. You want to contain the radiation since it's now laying on the bed, right? So we're going to contain it. A lead container is provided for that purpose. And then you can call the healthcare provider. This question was, what initial action do you want to take? I gotta look at the safety piece of this scenario. The safety is I gotta contain this radiation that's laying on the bed, exposing everybody that's here. Thank you for not wanting to put it back into the patient. board? That should be pretty, anybody have questions about that?
That was on the prep sheet.
Sure. When would that not be a right answer, right? I mean, we don't want to restrict that all word is a bad word, right, for your answers. We don't want to restrict all visitors. If you're healthy and well and you can stay far from your patient, there's no issue there. We know nothing about their fluid intake levels, so that doesn't make sense. And putting in a catheter doesn't make sense either. This is a priority question. It says, what's your first response as the nurse? 4. Circulation, A, B, C's. And then we can deal with the rest of it. I want to put an answer that says scold the patient. What are you thinking? I was kidding. No, I'm not. Sort of. I know, as one student said, we can see you rolling your eyes behind your mask when you're in some of those scenarios. Polycythemia. What's erythrocyte? What does that word mean? Okay, so which of those counts or one direction you expect them to go? Poly means many, everything. What's normal red blood cell count? So is that red blood cell count normal or not normal? It's normal. You have 2 elevated counts of everything. And is this elevated, that elevated, that elevated? Are any 1, 3, or 4 elevated? No. You guys good with that? You'll have an elevated red blood cell count, which will make your hemoglobin which direction? So you read that word polycythemia, I'm going to think what that is. Too many blood cells of everything. So I'm going to write down, before I get to the question answers, what those normal levels are. First of all, I thought through the fact that it's going to be elevated red blood cell count, platelets, and white cells. That's where your brain needs to go. Before I start cruising through the answers, I'm going to write down or remember what the normals are for that one, and that one. And that might have gotten you there before you start right away honing in on something as your answer.
So what's a normal hemoglobin count for grams per milliliter?
What's normal hemoglobin? Pardon me? 11 to 14.
11 to 14.
So that is the only count that's elevated on this whole list. So if you'd have thought through the fact that that's too many blood cells with that disorder, let me think about what normals are for all of those blood cells. I'm looking for the one that's going to be elevated. And that's how you could have gotten to 2 just by thinking through what's normal for all of those blood cell counts.
I just am not familiar with seeing it grams over milliliter.
See, and then that's where you sometimes all go astray because you focus in and hone in on some kind of something like that. I would not have led you astray by putting some funky lab value behind those numbers. Just good with that?
22.
So sometimes pause and process what's the disorder and what's this answer going to be about. Before I start pushing in the brain about, oh my gosh, what's this. I'm just so we write out what normals are, especially with the hematological disorders. Because some of them are 2 less, some of them are 2 more. So just keep those normals on your paper or in your brain so I can refer to that little chart when I see a disorder like this come up. Yep. You know, they didn't have the factor to absorb the B12 to begin with, right? And that's what we call pernicious anemia. What causes you to have decreased B12 even if you have the intrinsic factor? What are some other situations? Pardon me? Right. Typically, GI stuff messes with your, because that's where your B12 gets absorbed in your gastric system. So if you see a history of GI issues, Crohn's, a recent GI surgery, intestinal surgery, that may be causing you to have B12 deficiencies. For this patient, by definition, pernicious anemia is that he didn't have the ability to absorb B12 right from the beginning, because that's not how he was made. Well, what do you think? Yes. Why didn't you want to do one? Okay. Why didn't you do 3? And why didn't you just do 4? Can I just shave your patient for you? Okay. So that's a good way to think through that. Sometimes these are okay to delegate, but in the context of the scenario, your patient has hemolytic anemia. You as a nurse need to not delegate that, because you know the risk that the patients have with that disorder. So fresh vital signs, fresh out of post-op, don't delegate that. You're the nurse, you need to make sure that you have done those, you've evaluated those, make sure that there's anything concerning with those. So normally I'll say just look at the front verb. In this case, look at the context of what the task is. You're looking, the need for further teaching. You're looking for the wrong answer. You've given me education as your patient, and I'm going to say which one of those 4, and you'd be like, no, timeout. That's not correct.
4.
Yeah, what happens when you take iron, if any of you have taken iron? Constipation. So 3, sometimes if you get the context of this question wrong, you might say, yeah, I know that's not iron. I'm looking for the statement that means I need further teaching as your patient. So if you're going to do this in order, what is your priority action? Okay, so you want 3 first. I'll agree with you on that. Anybody have a thought about? How quickly is 4 going to manage his symptoms? Not quickly. So I would probably not put 4 second. You already said you're going to give him oxygen. I'd say 1 next. Oxygen first. He's in severe pain. If we get his pain under control, what might happen with his breathing and the rest of that stuff? It might help decide that, right? So we're going to go with give him something for pain next, and then what are you going to do? 3, 1, 2 is what I would do as well. And then what are you going to do with 4 and 5? 5, 4. Because keeping my room temperature at or above 72 is probably not going to change the whole critical state of affairs, right? It's a good idea. It's good patient teaching. Because, you know, sickle cell crisis can be triggered by severe room temperature changes. That's a great thing to tell your patient about when he goes home. But He's in severe pain. We gotta get him oxygen. You all recognize that. If I decrease your pain, I might be able to get your oxygenation to a better status, right? So I'm gonna do that. Then I'm gonna give you some hydration. We don't know if he needs that necessarily or not, but it's probably a good idea. And then we're gonna talk about patient teaching points. Okay, so you're gonna have decrease of what counts. Aplastic is a mess up, a decrease of all the cells. So you're gonna have decreased red blood cells, so which answer goes with that one? 3. You're gonna have decreased white blood cells. What goes with that one? And you're gonna have decreased platelets. There you go. So some of you all said, I just want to pick them all, but I want to know that you know exactly what blood cells are affected by that anemia. Breaking that word down is absence of, anemia is absence of all those white. Yes, he may have pain, we don't know. That doesn't necessarily go with that. He may have nausea, we don't know about that. What absolutely goes with that type of anemia are those 3 low. If you answer this question correctly, that tells me you know what aplastic anemia is, you know what blood cells are going to be decreased, and you know what's going to be the result of those 3 blood cells that are decreased. Versus just picking, I'm just going to think, I think all of it might apply. How do you know that the patient's having pain or nausea? That's where I would have asked myself. So you don't get on some place where you don't want to go with answering it correctly.
That's cute.
So I will go over the quiz assignments because I heard from some students like, I wish you would do the quiz assignments because we miss questions, we don't know what we miss, and then we don't always catch it in lecture. So your first, on your quiz assignment, you were given a chart and treatments and things, and one thing that you gave, which I think matched identically what I just went over, was stage for her ovarian cancer was T2, N1, and M0. So your first answer choice was you have 2 tumors. Not or correct or not correct?
No.
Not correct. That's not what T2 means. So get rid of that question. And the next, another answer choice was there is involvement of the lymph nodes. Is that true or not true? She was given a score of N1. Yep. And she was given a score of T2. So the nurse said you have a primary tumor. Correct or not correct if I give you a T2 score? That means there is a tumor present, because I've already figured out the size of it, right? That was the right answer. Your other answer choice was there is lymph node involvement, which there was. And it says, and distant metastasis cannot be assessed. What goes with an M if I can't assess it? MX. M0 means none. So if there was an MX in that staging score, you would have said it can't be assessed. And M0 means it is not present. The difference between X and 0.
But if it,
So MX plus is M0 with no evidence. Is that right?
Correct. X means I can't assess it because of the way, like
So-
they'll stage leukemias and that, and they'll put some X's that they can't assess some elements of that.
so if it's in the breast and it's in a lymph node near the breast, that's not considered an M1?
That would have been some kind of score that went with your N, because N is lymph node involvement. M is
So the M
metastasis.
is other organs then? Okay.
Good question. And the other answer choice was you have 2 tumors, which we already said was not right. T2 means you have a tumor, it's a certain size range. Okay, that was question 1. Question 2 is your patient's having brachytherapy. Brachy means where's the is he radioactive? Yes, inside of him, her. Brachytherapy means She is radioactive. Which safety precautions would the nurse implement? Your choice one was ensure the visitors maintain a 3 feet distance from the radiation source. That's wrong. Why is that wrong?
6 feet.
6 feet, okay. Prohibit all pregnant visitors.
Yes.
Yes. This is a time when you can pick all. C is assign the patient to a private room. That makes sense. I wouldn't want to expose anybody else. D is limit visits to 30 minutes a day. Yes, that was part of but you have to make sure they're not pregnant or not under 16, right? So we want to restrict all visitors. We don't want any more exposure to you than necessary for our patient. Guide patient contact with staff by principles of time, distance, and shielding. Yes, that makes sense. No more time necessary than by the patient to expose you to more radiation. Stay away from 6 feet and use a shielding device, either an apron or a shield. That makes sense. Your other answer choice next is ensure that staff members wear dosimeters to prevent exposure to radiation. Do they prevent exposure?
No.
Tricky.
So was it B, C, D, or E?
And then G is limit visits by children to 15 minutes a day.
No, it should be all children.
Thank you. Yep. Okay. So nurse prepares to administer the prescribed chemotherapy agent. This patient has ovarian cancer. Identify that the patient is at an increased risk of cardiac toxicity based on which risk factor? Choice one, hypertension. Yes, that makes sense, right? B is female. Yep, she's female. Kidney failure. Want that one or not? You think that makes her at risk factor for cardiac toxicity? Correct. Ethnicity, she's Caucasian. No. And your other choice was drug use, and she said she uses marijuana occasionally. No? We don't really have enough information to know how often occasionally is. And her age, she's 51.
What did he say?
I was said cancer, you said from age,
I will smack
Age is almost always 65 and older. When she's 51, Daniel,
Yeah. I might need to take a nap in my car if I hit the wall.
I'm gonna make note of that when you grade your.
I forgot. I have to go pick up our turkey, so I'm not gonna be able to stay.
Okay. I'm gonna record it.
Okay, yeah.
Yeah.
Yeah, if you don't mind, just send that to me.
Yeah.
Smoking
Yeah.
history.
I'm gonna upload it all to the YouTube page. I'll let you know.
Okay, cool.
I'm trying to do it today. But I am
Yeah, no worries.
tired. I've been sleeping good.
It's more than that to create a risk factor.
I am tired.
You should be smoking anyways, but by definition, I think it was.
I almost don't want to stay, but
Yeah,
I hope she at least gives some.
Good info.
And then history of meningitis.
Because like last time,
Is there a
Abby
correlation
handed her
between that and you getting cardiac toxicity?
a booklet of notes.
Birth
Yeah,
meningitis
that was
was-
awesome.
She kind of went through it.
Okay, question 4. The nurse provides post-op care following a patient's BSO, which is what? A bilateral salpingo oophorectomy, which is the removal of what body parts?
Tubes and ovaries.
And fallopian tubes is the S part. You'd monitor for what complication?
Bleeding.
A, fluid electrolyte imbalance. Sure.
Had you doing a quiz? That was my
You're
worst.
taking care of a post-op patient.
2.41.
I would probably
I got like a 1 point.
almost always pick that as
The last one I got like
right?
1 point,
Because
so
move
2.5 or
in
something.
during surgery, we expect your kidneys to start working following surgery. If I were going to do an educated guess, I would always probably pick that as being a post-op concern or something that I'm going to watch out for. Just by the nature of the way that works. Organ dysfunction. You want to pick that one or you don't want to pick that one? Organ dysfunction, I would also on that. We expect all of those things to go back into play. Bleeding, you all said that, right? Anything that's vascular. Wound dehiscence. Always a concern, right? We have an organ incision of any type.
I have a question about that.
question is what?
Isn't that a laparoscopic procedure, like, most of the time?
You made an assumption there.
Yeah, but like it is though, right? Isn't it? Isn't that
It can be, it isn't necessarily always the case, and you don't know that from here. You made an assumption. Don't go there, actually. Wow.
Come back here.
Thought you were setting us up. Thrombophlebitis. Anybody gonna watch out for that post-op complication?
Yes.
Of course, always. All right, next question. I'm providing information for a new graduate, so always blame the new graduates, right? About the prescribed chemotherapy agent. The educator identifies that which statement made by the nurse indicates understanding of the teaching. And the patient's been prescribed doxorubicin once on the first day of a 21-day cycle. Okay. The new graduate says, A, I cannot give chemotherapy until I've had at least 5 years of oncological experience. Anybody want to pick that one?
No.
No, there's no criteria like that, right? And the next time the nurse says, the new graduate says, the medication should not be given in a vein, in the hand, or wrist.
True.
That was the statement that made you understanding of the teaching. Because where should you give that high-dose chemo medication? Not the hand or the wrist, because typically what sizes are your veins? Correct. So we don't want to, we want to prevent, what's that complication?
Infiltration.
Extravasation, correct. Infiltration. But you're right, we want to prevent infiltration. Because if you have a chemo that infiltrates, you're going right there. A chemo that infiltrates, where's it gonna go? Outside the vein, into surrounding tissue. And extravasation is what?
Necrosis of the tissue.
Yeah, eating of tissue, exactly. So you are all right there. The next answer choice was the medication can cause a localized inflammatory response, but does not usually cause permanent tissue damage. No, yeah, that doesn't mean that you understand it because we're talking about chemo. And D, with this type of chemo, extravasation cannot be prevented, but an antidote can be given to limit tissue damage. True or false, extravasation can be prevented. Correct. And don't mix that up with infiltration. It may infiltrate, but hopefully if you're monitoring close enough, it's not gonna start eating away the tissue around it, causing extravasation.
So was B the correct answer?
The correct answer was, I shouldn't give it in the hand or wrist.
Okay, thank you.
You want those nice big veins or a central line if you're giving chemo, or a PIC or whatever else. When reviewing the patient's lab results following the chemo treatment, the nurse expects which finding? A, white count greater than 4,000.
What's this for, say again? I'm sorry.
They're getting doxorubicin for ovarian cancer.
So yes.
Which way do you think the white count?
It's gonna be.
Correct. Probably be low. So you don't expect a white count to be high. Lowest blood count, 21 to 28 days after chemo is given. Lowest blood counts occurring in 21 to 28 days after chemo is given. Okay, so what's the lowest count for your red blood cells? 2 to 3 months. White count. 7 to 14 days. Platelets. Okay, correct. Keep track of those. Know what implications all 3 of those counts have and how you're going to educate your patient accordingly. And don't tell your patient, just stay away from everything that might cause you injury or problems. The next answer choice was myelosuppression. The next answer choice, thrombocythemia. What is cythemia, thrombocythemia? Too many or too? Too many. Would you have too many platelets following your chemo? Which direction do they usually send all your blood counts?
Down.
So are you gonna have thrombocythemia or not?
No.
No. And red blood cells less than 4.2 million. Which way will your red blood cells go? What's normal red blood cell count?
5.5 million.
Okay, so are you expecting a lowered red blood cell count?
Yes. Not with too. I think there's too many.
What?
I think there's too many.
No, we're talking about somebody that just had chemo.
Yeah.
We're not talking about polycythemia. Break the word down, keep the context and situation going so you're staying right there. Okay, the nurse would intervene after observing another healthcare provider performing which treatment when managing the patient's mucositis. So you're looking for what? You're going to intervene the wrong action. So one answer choice was uses normal saline mouth rinses every 2 hours. Are you going to intervene if I'm doing that for your patient? No. I remove dentures except for meals. Are you going to intervene if I do that? Because you want to do that if they have mucositis, you don't want those dentures in any more than necessary, irritating. So that's cool if I do that for your patient. Applies water-soluble lip lubricant. You're going to intervene if I do that? No. I'm going to also gently floss the teeth after every meal. No. Isn't that good dental hygiene? Why can't I do that for your patient?
Your tooth shouldn't make them bleed.
When determining healthcare team assignments, the nursing team leader notes the patient's morning lab results and would assign which nurse to the patient. Their red blood cells are 2 million. Their white count is 50. Their ANC is 300. Their platelets are 75,000. So which direction is their ANC count? Good or bad? 300. What is yours supposed to be? Correct. So is their ANC count low or high? Low. And their white count is 50. Okay. So they have a low neutrophil count. What kind of precautions should I put them into?
Isolation.
Neutropenic precautions, right? And you're protecting the patient from you. My germs to the patient. So here are your nurse choices. I'm trying to figure out if I'm coming in and you're going to give me an assignment to a patient, given this patient, who are you going to give this patient to? What nurse? Your choice is A, a nurse who received an MMR vaccine 1 day ago.
No.
Why not?
That's a live vaccine.
A live vaccine. Yep. The next choice is a nurse who received the pneumococcal vaccine 2 days ago. You're going to give that. What is your hesitation or what is your decision on that?
It's not a live virus.
Is pneumococcal vaccine a live virus or not?
No.
No, it is not. So if I had a pneumococcal vaccine 2 days ago, should I take care of this patient or not?
Yes.
Yes, no harm, right? It's not a live virus. The next nurse choice is a nurse who states, I'm pretty sure that my head congestion is related to allergies.
No.
Why aren't you giving that? You could have a head cold coming on or something else. We can't assume that. We don't want you taking a chance of taking care of this patient. And your next choice says, a nurse reports, I get very claustrophobic when wearing PPE.
No. You probably should go grow up.
If you're picking people, ideal people, if I tell you that, what's the chance of me wearing all the garb going in to take care of your patient? Ethically or not, you could deal with that at another point in time. But if you're trying to sit here and make out patient assignments, if I say, honestly, I'm probably not gonna wear all that stuff when I go in his room because I just get real claustrophobic. Plus, that's not the ideal nurse. If you're comparing all 4 of the nurses we just talked about, who would be the ideal nurse?
Number 2.
2. So don't go down the path of, well, 4 should be talked to because she has to wear it whether she likes it or not. He likes it, but don't go there. That's not the question. The question is I got 4 nurses to pick from. I'm trying to figure out which one of you 4 would be the ideal person. And understand the whole live virus versus the non helps you make that decision for that question. That is the quiz assignment. Anybody have questions from the day today, from last week, for the test, for the final? Any of the above? Are you going to be upset if I let you all out early? If you are, we can talk, review. Like I said, if you have questions that you want to review that can be answered over email, we'll try to do that. If you want to meet, set that up
Piece of
early.
notebook paper.
If you have anything
You want a
else
big
we
piece?
can help you
Yeah,
out with,
big piece,
whether it's
please.
notes, questions, clarification, give a holler. If we do meet with you, it's best if you kind of come in with a game plan on how we can be most helpful.